to talk about today. We're going to have Samantha go first and share some things she's been working on to keep you guys posted on marketing efforts and give you tools to use them at your own organizations. And then Dave and Wayne are here with us to do our regular legislative update. So I'm going to go ahead and give it over to Samantha.
Thank you. So everybody should have gotten an email this morning. I've decided to start doing these membership marketing kind of newsletter emails. I know we've talked about, you know, how to better connect some of the activities and programs that we're doing at the state level with the counties. So I hope to do these every month. So look for them the first month or the first week of every month. The email will have, you know, upcoming events, any county events that are added to our calendars will be on here too, if they're able to be cross-promoted among different counties. Some different program posts that I've pre-written that you can just pop in to social if you're looking for things to share there. And then we're usually working on some major campaign each month, depending on what's going on. So this month is, you know, we're headed into Thanksgiving somehow already. So Giving Tuesday is the Tuesday following Thanksgiving. So we'll be doing kind of a promotional effort for the foundation. So if you wanted to participate in that, I made some social graphics and email posts and things like that. So you'll be able to find all these resources in that monthly newsletter and then also on the county share site. So if you think of anything that maybe you would like to have from us that I can include in there or even just post on the county share site, please feel free to reach out and we can work together to get that created. If you're planning an event that you want promoted across other counties or at the state level, feel free to reach out and we can include them in this as well, or just kind of get them posted on PA Med Social or the event calendar. So if you have any questions or want any extra resources, just feel free to reach out. Looking ahead, we're already starting to plan our Doctors Day initiative. So National Physicians Week is March 25th to the 31st. Doctors Day is that Thursday, March 30th. So last year we had done a lot of reach out to the public to get nominations. We're kind of hoping to do that again. We had physicians nominate physicians as well too. So we'll do something similar. We'll be going out across the state to kind of give a couple different physicians recognition that day, get some live photos and engage some of the practices. So if any of the county executives or staff are interested in helping in that effort and doing some recognition on the day of, please let me know, because we would love to kind of spread out the entire state and get all over the state. We're also looking to get donations from sponsors like we did last year. So if you have any friends that have or connections with any companies that would want to donate to that kind of gift raffle thing that we did last year, then please connect them with me or just kind of reach out on your own and let me know what you have. And of course, if it's on a local level, we'll make sure that, you know, if it's in Allegheny County, that a Pittsburgh physician would get that kind of thing. So does anyone have any questions about kind of like the social media efforts or things that we've added?
Samantha, Mark, again, thanks for the newsletter piece. Looks really like a great opportunity. And like you said, they're just plugged, like you can drop them into emails or on our website. So thank you. That's really nice of you to do that, or your whole team. Appreciate it.
Yeah, of course. I hope you guys like it. And like I said, if as we do these, if you're like, wow, it would be really great if I had help on this upcoming awareness day or something like that, just reach out, because I would love to help with that.
Hey, Samantha, I'm going to email you after the meeting. I did not receive that, and I would like to be on that list.
Okay, yeah,
And
let me make sure.
Yeah, don't even worry about now. I don't want to bog down the meeting, but I'll send you an email afterwards.
Okay.
Thank
Yep.
you. Thanks.
Kayla has her hand raised. Oh,
Yeah, hey Sam. I think when we talked last week, we were talking about 40 under 40. So those like nominations are like the deadline on that is at the beginning of January too, just since we were
yeah,
talking about Doctor's Day.
Yeah, I skipped ahead a little bit there just because the getting sponsors for Doctor's Day, we have to start looking for them now because last year I asked a little too late and a lot of organizations were like, oh, you asked way too late and we can't turn around a donation that quickly. The awards nominations are closing January 15th. So that's for the top positions under 40, the Distinguished Service Award and the Voluntary Service Award. This year it's the Community Voluntary Service Award. So I have some posts in that newsletter promoting that, but if you guys need anything else, I think next month's will focus on the main feature campaign will focus on awards because this is the time we really get a lot of nominations. But nominations at the county level would be really great. Because, you know, we tend to see a lot of clustered nominations, especially in the top positions under 40. So the more nominations, the better. So if you need anything else on that before next month, then please let me know and I'll get that ready for you. Okay. If anything else pops up, just send me an email, Nadine. I'll get you this newsletter and get you on the list. But thanks, everyone.
Okay, anything else for Samantha with regard to marketing or anything you might need on your end? All right, then Dave, we'll let you go ahead.
Hey, Sam,
Or-
don't leave, Sam. You're going to stay on?
Yeah, I'll stay on.
Okay, because I'm going to talk a little bit about the SOPP site, and you may, if you want to share some of the most recent statistics, you can, because I don't understand them. Let me start with Eileen, who is showing her team spirit. Good for you, Eileen. Where we are is the session has, for all intents and purposes, ended. As I've said before to you guys, they don't have lame duck sessions anymore, though never say never. There was speculation that they may come back after the election to do some political things, namely indicting, not indicting, is that the right word, Wayne? Impeaching Larry Krasner in Philadelphia, but I don't know if that's going to happen or not. There was some speculation they may come back after the election to do some things that were agreed to. They just didn't get to it, but I think it's probably unlikely. So the legislature is out. They will come back after the election to do some goodbye speeches for members who are leaving. They'll do that after the election. I think it's the week of the 13th and 14th, or that following week after the election. But then otherwise, they're out until mid to late January. So that's a good thing. We did get prior authorization finally passed. For those of you who are wondering what all is in the bill, you're not alone. We are too. We are in the process. Wayne is putting together a detailed analysis of the bill. And then our hope is to work with the payer relations folks to do maybe a Q&A of some sort. There's a lot of questions that remain unanswered, such as how many of the 15 pages of definitions do we include in an analysis of Senate Bill 225. So we're working through all of that and hope to have something very soon to share with not only you folks, but also with our members so they understand what the bill does. Interestingly, I can tell you that I had lunch yesterday with a friend of mine who's a former PA Med board member, but he is also now the CMO of Geisinger Health Plan. And we had lunch up in Danville yesterday, and we were talking about the bill, and he kind of smiled. He said, well, I know one thing, it's going to cost us a ton of money to comply with the provision that requires them to have a like specialty, similar or like specialty when it comes to denials and appeals. And I kind of laughed and said, well, if you're miserable, then I'm happy. If that makes you unhappy, then it must be good for us and for physicians. But bottom line is, I think it's a good bill. We did not get everything we wanted. You never do. But I think on balance, it's a good first step. And that's what we sort of build it as with legislators. Hey, this is not everything we need or want for patient care, but it's a good first step forward. So stay tuned. We will have something out to all of you hopefully very soon. There's varying, and Wayne can maybe help me, there's varying effective dates for different components of the bill, ranging, I think, Wayne, from 60 days effective date to like not effective until 2024. Is that right?
Well, it's not as varied as that.
Okay.
There's a provision that requires the insurers to create provider portals on their publicly available website. That goes into effect. That section goes into effect this coming January, giving them 18 months to get that up and running. So that goes into effect January 2023. The remainder of the bill goes into effect January 2024.
Yeah. So I mean, there's definitely some nuance as to when various parts of the bill are going to be effective, but bottom line is, hopefully, it's going to provide some relief to physicians who are dealing with prior auth all the time. Switching gears, we did get another bill passed that had been kind of hung up in some political wrangling, and that is the EPT bill, the Expedited Partner Therapy bill, so that now physicians who are seeing patients who have a STD, or I guess they call it STIs now, that they can treat their partner without seeing them. Now they were able to do that before, but they kind of had to do it a little bit circuitously. A lot of physicians, if they want to treat a partner for an STI, they would simply give the patient 2 refills on an antibiotic and let them, fill it twice and then give that other prescription to their partner. This new bill kind of paves the way and provides some statutory framework to allow physicians to treat those individuals and not have to play those games of writing different scripts and refills, et cetera. So it's something that the OBGYNs wanted a lot. It was important to them. And I think to a lesser degree, family physicians or anyone, quite honestly, who's treating a patient who may have a STI. So it's good stuff. It's good medicine, and it's very pro-patient. So that finally passed. That has been in the works for several years, and that's good news. So there were a couple other things that went through. One bill to account for patients who have eye drops and they're giving themselves eye drops. And as all of you, if you're like me, you give yourself an eye drop and 3 drops go in your eyelid and 1 goes in your eye. And patients were experiencing situations where they were running out of their eye drops because they had, wasted the eye drop, and they were unable to get it refilled because of either the physician wasn't available or it only had 1 refill, et cetera. So that piece of legislation does allow for refills to complete a course of treatment for patients who are dealing with eye problems. So, ophthalmology was supporting that very heavily, as were we. I do have to say that we were not the point organization on some of these bills, but we certainly weighed in on all of them. which, I think helped. It certainly didn't hurt, but I think our weighing in on these bills definitely got some of them across the finish line. With that, I will end the legislative portion. I don't know that there's much else to talk about. Anything else that was in the pipeline, whether it was restricted covenant, whether it was any other piece of legislation that we had been working on, those bills as of November 30 will die and will have to be reintroduced next session. And we are already working on the reintroduction of a variation of non-compete. We're working through that, and we're also working on possibly taking the lead. I'm hoping Wayne's not going to cringe, but taking the lead on credentialing legislation, which is something that our physicians still complain about. I know the dentists want to work on credentialing as well. It's a question of whether or not they're going to take the lead or we're going to take the lead. But either way, we will be engaged on the credentialing issue once again. That was an issue we were dealing with a couple of years ago, and it kind of fell by the wayside in light of prior auth and other priorities. But I think that issue is going to come back next legislative session. With that, I am going to technologically wow all of you by sharing my screen. We applied for a grant from the AMA for scope of practice issues. And what we did was we came up with the idea of putting something out there to patients that explained, in essence, a little bit about the healthcare team, who they are, what their training is, etc. And we sort of ended with this. And what this is it's a microsite. Claire or Sam can explain more about what all that means, but it's a microsite within PA Med, and we are putting out social media, Sam, or just digital advertising? I guess both.
It's both.
Okay,
So it's on Google, Facebook, and Instagram.
So if you are, and Sam, chime in if I screw up, if you are a woman aged 20, early 20 something to 55, what is it?
We women in Pennsylvania ages 24 to 55, and then men ages 54 to 65, I believe.
Okay.
Is the age. I always forget the men one.
Everyone forgets the men. Just so everyone knows, the rationale there was that women are the primary decision makers on healthcare for families. Certainly for families with young children, they're making the decision when to send a kid to the pediatrician, take them to the doctor, etc. So we are, geo-targeting those groups, so that if you are a woman in that age group and or a man in that age group, and you get on Facebook or Google or whatever, any of those platforms, this ad is going to pop up. And then hopefully they will click it and take them to this site. Basically what the site does is it talks about, wearing a white coat doesn't always mean the person in it is a physician. So it's a little bit of a teaser to get patients to look at this and say, what's this all about? You have this wheel here that moves depending on what you select and tells them whether or not they're a physician or not. So CRMP obviously is not a physician, but a DO is, and gives you a little bit of information down here about the various degrees of training. But I think the other part that is, I think, a little bit more interesting is this section here, where it encourages patients to ask questions. Ask questions of yourself, as an example. Talks about, do I have a chronic condition? Is my diagnosis long-term, etc. If the answer is yes to any of those questions, we're saying a physician should be directly involved in your care. And then the hope is when they go into the exam room, our ultimate goal here is to have patients look at whoever is in that white coat in their exam room and say, are you a physician? If not, is there a physician on my healthcare team? And what role is the physician playing in my care? So it really, we had to walk a really fine line. We didn't want to minimize the importance of non-physicians on the healthcare team, but at the same time, we wanted to make sure patients knew there was a difference between the providers, and frankly, to ask. Because we have heard, and I'm sure you have too, we have heard anecdotally where patients, a nurse practitioner comes in and introduces themselves as, "Hi, I'm Dr. So-and-so," because they have a PhD, or I'm a PA and I have a PhD. So really, it's just a matter of trying to raise awareness. The AMA was very generous. They gave us a $75,000 grant for this. The bulk of that money is going into the digital ad space. The creation of the site, really, I credit Sam with 95% of it. She did a great job of working with our consultant and really coming up with a lot of the content you see on there. But bottom line is, our hope is it's going to get a lot of traction. Sam, do you have some numbers to share with them? That might help them?
Yeah, I'm just looking at Facebook and Instagram right now, but there's a couple hundred link clicks and then about 7,000 impressions. And what's actually really good about that is the reach is about the same. So if you know the difference, impressions is how many times it's been seen on somebody's page. The reach is how many times it's been, how many individual people. So it's reaching a lot of people, and not a lot of people are seeing it more than once. So in terms of raising awareness, that's pretty good, considering we just started the advertising on this the week of House of Delegates. So it's been good.
Yeah, now, and I can tell you that, we're hoping, I'm going to be meeting with the AMA folks tomorrow and sort of presenting this to them so they can see it. My hope is to backdoor some additional money from the AMA to continue this advertising campaign through next year. The whole idea was to create this thing because of the changing dynamics next legislative session, where we are losing Dave Hickernell, who is the chair of the licensure committee. And that could be very problematic for us when it comes to scope of practice issues. So the whole idea was to try to start now in the fall, build some awareness within the general patient community in hopes of, maybe even transitioning this site into a site where we're going to be asking patients to make calls to their legislators as patients. What, Sam?
I just realized it's November 1st and my screen updated. So that was only numbers from today. I was like, wow, I don't know what's
I was
wrong
thinking
with
that was
what I'm
low.
I know it's 500,000 impressions. This is much better. 500,000 impressions, and we've received 4, 8, 14, 15, like 17,000 clicks. I was like, something is wrong here, and I'm reading these numbers, and it's because it's November 1st, so it moved over. So it's being seen by a lot of people in Pennsylvania, which is really exciting. I need to get in touch with our IT team to get the web analytics, but the clicks should be pretty representative of how many people are actually visiting the web page.
Just so you also know, and we'll be reaching out to you again for maybe some feedback, and I'd be curious to know what your thoughts are at some point. And that is, is the next step of this to provide physicians something to actually put in their offices? Now, Sam reminded me that you got to be careful because, there may be physicians who will not want to aggravate, if you will, the nurses and PAs who work in their office. Although I don't know that this should be aggravating them, but they may be sensitive to it because it does, not question their contribution to the team, but certainly differentiates them. So, again, it could be a very fine line. But, having something like this, even a reference to the website available in physician offices may be something we're going to explore. So I don't know what your thoughts are about that, but next year, hopefully we'll be able to continue putting some resources into this, again, in hopes that, it may turn out to be a great avenue with those kind of numbers that Sam just said. It may be a great avenue to get patients directly in calling their legislators. So does anyone have any questions or thoughts or comments about any of that? No? You've all been wowed sufficiently? That's all I have. So thank you.
You wowed them into silence, Dave.
No, they're just tired.
Any questions for Dave or Wayne on anything legislative? Okay.
Oh, one last thing, Claire.
Sure.
With all the new members coming in to the legislature after the election, and there could be a pretty fair, sizable number of new legislators, we will be looking at all of those new members, where they are from throughout the state. And if, there's a number of them in your area, one or two or whatever the number is, we'll be reaching out to you to hopefully coordinate some effort to get local physicians and yourselves and us to sit down with those new members and talk to them about issues and introduce them to not only the county medical society, but also to your local leaders and whatnot. So, at a minimum, it's going to be 30 plus new members because that's how many retirements we had. But I think you're going to see some incumbents possibly lose as well. So we could see 40 new members of the legislature this next session. So that's good in some respects. It's bad in others that we're losing some, real friends in the legislature, but it does provide opportunities to develop new relationships with folks. So we'll be in touch with you at some point after the election.
Okay, before you jump off, just one thing I wanted to mention. Our phones and our emails are out of control with license renewal. I assume you guys are probably getting those questions as well. I just want to be very upfront. We are working really hard to get them all answered and taken care of. As you can imagine, they're wanting an answer immediately, and we're not able to get back to them immediately. We are shooting for within 2 business days to reply. My biggest ask of you all is to continue to share the pamedsoc.org/licensure site, because truly 95% of their questions are answered there. We redid it this year and we got together and literally came up with all of the questions that we know that are common and that we continue to get, when the license cycle is happening. They are there. I understand they really want those answers immediately. They want to call, but we are struggling to keep up with that volume right now. So just wanted to share that is happening. And if there's anything you're sending out, or if you're talking to people, if you can encourage them to check that site, because I do think they will find most of their answers there and not be frustrated with waiting for a call or an email to return to them. We will get to them. We are working really hard to get to them quickly, but it will not be instantaneous, which is what they are looking for. So just wanted to share that resource and ask that you please share that resource as well if you have the opportunity. And that's all we have for today. Is there anything else that anybody wishes to discuss or ask or suggest for our next meeting? The December call, we will have our HOD speakers with us, and we will focus on feedback for the HOD on that call. So please mark your calendar. It is, as always, I think the first Tuesday, I'm going to look, the first Tuesday of the month, which is December 6th at 9 a.m. So is there anything else? You're still silent from Dave, I know. All right. Thank you, everybody. Have a great day.
See you.